Hello and welcome to Arogya PhysioTips. Arogya PhysioTips में आपका बहुत स्वागत है. In today's video, we'll be discussing a very important topic which every new mother should know about, which is pelvic floor strengthening post-delivery. So as we all know, if you had a vaginal delivery or a C-section delivery, in both the cases, your pelvic floor gets severely impacted. In case of C-section, it is cut open, and in case of vaginal delivery, it has to stretch too much to accommodate the head of the baby. So in both these procedures, it is put under a lot of stress and it gets weak over time. Hence, it is very important post-delivery that you start with strengthening these muscles. By doing that, it will help in preventing leaking of urine when you cough, sneeze, or jump, which is also known as urinary incontinence. It will prevent bladder collapse or rectocele, cystocele, all of those conditions. It will prevent development of diastasis recti. It will prevent low back pain and all the other problems that women face post-delivery. So the precautions that you have to take while doing these exercises, one is that start these exercises only after 6 weeks post your delivery. Also try to take the opinion of your gynecologist before you start with any of these exercises. Stop doing them if you feel too much pelvic pain. If you feel a bulging in the vaginal area, stop doing these exercises. If you feel too much pain around the C-section scar, even then stop these exercises. And if you have severe DR, which is more than 3-4 fingers, or a hernia, then also avoid doing these exercises without talking to your physio or your gynae. First exercise is called umbrella breathing or 360-degree breathing. So you will keep one hand on your chest, one hand on your stomach. Always breathe in through the nose, fill air equally in your chest and stomach, and then blow out through your mouth and pull your stomach all the way in. So I'll demonstrate it now. So when you breathe in, your chest and stomach should rise up. When you breathe out, you will pull your stomach all the way in. So you will do this breathing in one sitting around 30 times and try to do it 300 to 500 times in the entire day. Okay, the next exercise is also the 360-degree breathing, but you will do it in the crawling position. So if you have DR, you will do it in the crawling position. If you don't have DR, you will do it with your knees up in the air. Okay. So if you have DR, do it in this position. Breathe in through the nose. Breathe out through the mouth, and same way you will pull your stomach all the way in. One thing you can add in this exercise is Kegels. So when you're passing urine and you try to stop the urine midstream, the muscle that you contract, doing that is called doing a Kegel. So whenever you breathe out, you can do a Kegel. So you will breathe in, fill air in your chest and stomach, and when you breathe out and pull your stomach in, also do a Kegel. If you have no diastasis recti, this is the way you do it. If you have diastasis recti, while breathing out, I also want you to lift your knees slightly up in the air, only around 1 inch from the floor. So you will breathe in normally. When you're breathing out, you will pull your knees up. Breathe in down. Breathe out up. Exercise is called bird and dog. So in this exercise, the movement is going to be from crawling position to opposite hand and leg up and back to crawling position. The breathing is, you will breathe in when you're in the crawling position. While lifting your hand and leg up, you will breathe out and do a Kegel like how you did in the previous exercise. Again, breathe in, breathe out and Kegel. And breathe in. You will repeat the same thing on the opposite hand and leg. Breathe in, breathe out, Kegel, and back down. 10 repetitions on each side. The next exercise is also bird and dog, but with pulses. Okay, the breathing pattern also remains the same. Breathe in crawling position. Breathe out when you go into bird and dog. But once you're here, I want you to pulse your arm and leg up and down for 5 to 10 seconds. Here you will keep breathing normally, no holding the breath. Same way, repeat it on the other side. Breathe in crawling position, breathe out, hand and leg up, and slowly pulse. The next exercise is sideline abductions. So you will be in the sideline position. You will simply keep your leg on the bottom, bent, the knee is bent, the upper leg is absolutely straight. Your shoulder, hip and feet are in one straight line. You will lift the leg up and down. You will breathe out when you lift the leg. Breathe in and bring it down. If possible, try to add a Kegel when you're breathing out and lifting. So Kegel and relax. Kegel and relax. Same way you will repeat on the other side. The next one is a sideline hip flexion resisted exercise. You will start again with both legs straight. The upper leg you will bend at the hip and knee, pull it towards your chest. At the same time, you will use your hand to resist the motion. So you will push in the opposite direction. Again, straight, breathe in, push, breathe out. Straight, breathe in, push, breathe out. Again, 10 times on the left and then turn around and 10 times on the right. Next one is sideline adduction pulses. So the leg on top, you will keep your feet in front of the knee. Okay, maintain this position. The lower leg, you will pull up and down, but as fast as possible. So do it like pulses. Keep breathing normally, don't hold your breath. Around 10 seconds, 3 sets on one leg and then the same way, 3 sets on the other leg. The next exercise is fast Kegels. How you will do this? You will relax your pelvic floor, let your back have the normal arch. Again, breathe in through your nose. When you breathe out, you will do a Kegel and leave it. Again, breathe in through your nose, do a Kegel and leave it. So try this at your pace first and then I want you to do it as fast as possible. So you will just contract, relax, contract, relax. So this is something you will not be able to see externally because it is happening in the muscles of the vagina. So you have to do it as quickly as possible. Contract, relax, contract, relax. So do 20 and then try doing 2 sets. Exercises, slow Kegels. So the same thing that you did previously, which you were doing very quickly, now you will do it slow. So you will take a deep breath in and when you're breathing out, so for these 5 seconds that you're breathing out, you are constantly holding the Kegel for those 5 seconds. And then relax, breathe in. Again, during the breathe out of 5 seconds, you will constantly hold the Kegel. Again, try to do 22 sets. While doing all of these exercises, it is recommended not to hold your breath, so don't do that. Also, continue doing these exercises consistently for at least 2-3 months. So start feeling changes. You will not see the changes immediately. So make it a part of your everyday routine. Also, the breathing exercises that are taught in this video, try to do at least 300 to 500 conscious breaths. That will keep your pelvic floor active throughout the day. If you have any other doubts related to the exercises, want us to make more videos, please comment in the comment section below and witness your fitness with us.